I probably will not tell about Wise Mind today. Thank you for mentioning it. So my topic is to give a kind of general overview in the mental health care in Latvia and also its challenges. So yeah, I think this we know, every one of us knows that really mental health is really the most important health issue now during the last decades, and Latvia, of course, has high rates. Actually, if we think about all mental disorders, but especially if you think about depression, so you can see here that major depression is only one disorder of all mood disorders, and it is like 7% of major depression rates in Latvia, and 18% of population had reported elevated depression rates already in 2019, and there are high rates of undiagnosed depression now. So the same with anxiety disorders. So more than 40% report anxiety symptoms in Latvia. And as we know, Latvia is in the third place in the Europe in suicide rates. So all of this is really very high, and we need to develop really treatments for that. And what actually happens? So these first sentences so this is about world. So we know, all of us knows that we really need interventions which are focused on changing our thinking about ourselves, our perception of the world and other people, our emotions and behavior, as well as improving communication. And this is really more important than medications if we think about mental health disorders in long term, or we have to combine them both. And what we know in the world, and Latvia, of course, is in the same situation, that 70% of people with anxiety and mood disorders have actually no access to psychological help. And most people with mental disorders receive either no interventions or interventions without any scientific evidence. Still, we are all here alive, and so some of us even learns to dance in rain, as in this picture. And if to think about who helps us to dance in the rain in all the challenging circumstances we have in the world. So this is statistics about our helpers. So what we have in Latvia, with our 1.87 million inhabitants, so we have actually only 265 psychiatrists. Excuse me if I forgot to count somebody who finished studies last year. And in register of psychologists, there are 761 clinical and health psychologists, which is actually really a small number. And 557 certified psychologists in total, which means that there are also included school psychologists and organizational psychologists. So, and also we have this strange situation with all these psychotherapy regulations. So we have 71 psychotherapists with medical education background. We have, we have around 80 CBT therapists and also 190 psychotherapists who represent 9 therapy approaches. So these therapy approaches are those we have in Latvia: family therapy, psychodynamic therapy, etc., which are mentioned here. But still, we have lots of problems, which I will tell a little bit later. But I would like to really stress the importance of our small or bigger steps we really take during last years, especially during last 5 years. So we really try to develop multidisciplinary teams in psychiatry And what is also written in our mental health development plan is that we really need to increase it in both in Riga and in regions of Latvia. Still, unfortunately, this year we have no funding about in developing this these multidisciplinary teams and also other approaches which are described in those guidelines in those plans, as well as development of outpatient services. Also, good information is the Ministry of Health has this project about free 10 consultations. Who each person of Latvia can receive 10 consultations per year of psychological help or psychotherapy. But unfortunately, actually, this number is very small if to think about our amount of inhabitants. So it was last year. It was these were 2,000 patients who received these free consultations. So, and this is like much too little as really is needed. I would say there is really rapid development of child mental health services in Children's Hospital. Also, Adolescent Resource Center is opened and has been working very actively, as well as different kind of community-based services and NGOs. But still, there are many challenges, and in both in system and in mental health care system in general, and especially if to consider those points. So the first and the most important probably is access to non-pharmacological treatments at all, like psychological help, psychosocial interventions, which are focused both on symptom alleviation or also solving causes of disorders. So we really lack in both in mental health system and also even in private sector, really waiting lists are very long. And people,
Ieva, we are running out of time.
Sorry. So this is actually the last slide. So we also lack scientific studies. We have only some. So regarding effectiveness, efficacy of our help, also availability of human resources in general, effective collaboration about different professionals, and also regional development, as we know that mostly all help is concentrated in Riga. So in conclusion, I really would like to increase all kind of effective helps and as well as really scientific studies. So that's it. Thank you.
Thank you, Ieva.